Hey everyone, this is Don Anders, and a lot of you, if you're watching this, you might have seen our other video on health insurance options if you're retiring from drop under the age of 65. In this video, we're going to talk about specifically if you're over the age of 65 and Medicare. Once you're over the age of 65, whether you're exiting, at 65 or turning 65 later, or even later, you are eligible for Medicare. Now, the nice thing to know about Medicare is you're going to be covered. If you're leaving credible coverage, you will be covered when you go in. Even if you're 68 or 69 or 70, when you retire, you will still be able to get coverage if you're going from credible coverage to Medicare. Now, what a lot of times people think, okay, but if I go on Medicare, what if my doctors aren't on there? Or what if I can't, use the same things as my current insurance, my current network? So there's two things. There's basically two parts of Medicare. Okay, so you have Medicare A and B, which you're going to get either way. Almost all employer plans require you to get Part A and B, even if you stay with their coverage. And then you have your supplemental insurance. Or Advantage plan. So there's two things there. There's a supplement plan and there's an Advantage plan. I'm not going to get super into it because Medicare can be pretty complicated. We have in-house Medicare people that can help you. They deal every day with Medicare for people exiting drop. So in that your exact specific kind of niche situation. But here's what you need to know. If you're worried about coverage, if you're worried about being able to go to whoever you want and having good coverage, you probably want to look at a supplement plan. Now, a supplement plan costs a little bit more. You also have to get a standalone drug plan, but your insurer at that point is not the insurance company, it's Medicare. And so as long as your doctors or hospitals or whoever accept Medicare, they will accept the coverage. So you'll hear people say, I don't want to go with United Healthcare or Blue Cross Blue Shield or whoever it might be for my Medicare supplement because my doctor doesn't accept that. They don't accept that insurance, but if they accept Medicare, they will accept those companies' supplement plans, okay? So very simple. If you want a broad range of coverage, pretty much the widest coverage out there will be Medicare and then a supplement plan. The other option is to go with an Advantage plan. Now, an Advantage plan will be cheaper than a supplement plan. There are a lot of plans that are free. There are some that will even refund your money, some of Part B money. But you have to be careful because with Advantage plans, it's all based on the network. So if you do decide to go that route, I'm not saying that they're bad, but you just have to make sure that the doctors you want to go with are in that plan. You want to make sure that the drugs that you're taking are covered by that plan. So you just have to make sure that you're shopping it and doing it right. But if you want the best coverage and you want to go to almost anyone, you want to look at the supplement plan. And almost always it makes sense to do that over continuing your employer's health insurance because usually it'll be cheaper and better coverage if you go with the supplement plan or maybe not as good coverage but free if you go with the Advantage plan, right? So it almost always makes sense with a couple of exceptions. Number one, if you have TRICARE or something like that, TRICARE, if you don't know what it is, it's a insurance plan offered by the federal government, specifically the military usually. That's a great plan, right? And it covers almost everything. So at that point, you probably don't need a supplementary Advantage plan, but you probably should have been on your employer plan after you retired anyways. Number two is if you have really expensive medication. So we know people have very rare diseases sometimes, that the medication, I've seen people where their medication would be over $1,000 a week. And so you want to make sure that whatever supplement plan or Advantage plan will cover that medication. If it doesn't, and your employer coverage does, then you want to stay there. But for 98% of the people that we meet with, once you turn 65, either when you retire or after you retire, it makes sense to switch from whoever your insurance is over to Medicare. Now, the big thing that I would recommend is you want to talk with somebody who works with multiple Medicare options and multiple Medicare supplement and drug plan options and advantage options, because a lot of the people out there who are Medicare insurance agents, they usually, a lot of them, not all, but a lot of them work for only one company, meaning that they might work for, I don't want to throw any names out there, but they might work for ABC company, and that's all they can provide you. So if there's not a better one, there could be a better one, this company over here, this company over here, there's dozens of them usually. You want to be able to work with somebody who can give you multiple options there. And working with a Medicare agent doesn't cost you anything else. So for instance, if you were thinking about going with the United Healthcare supplement policy, and that's the way you want to go, it doesn't cost you anything to have an agent. There's no extra cost, and the agent will do the paperwork and help you, and when open enrollment comes, shop plans and everything else. So my recommendation is, if you're going to talk with somebody, make sure that they can offer you multiple different things. And you can do that by one of two ways. That our Medicare agents and that we have will offer multiple things if you want to meet with them, and we'll have a link to the calendar in the description if you'd like to book a complimentary appointment. The other option is, if you're meeting with somebody else and they give you an option, say, could I get maybe 2 or 3 other companies that you work with, and just so I can see. And if they can only offer you one company, you might want to get a second opinion. So just something to think about. I mean, it's a pretty costly decision. And also the big thing, if you're going with an Advantage plan, that's the most important thing to shop, because your network might be extremely limited with some of these companies. And then also just remember, for Medicare, just like almost anything, if it sounds too good to be true, it probably is, right? If someone's refunding $100 a month, they're actually paying you to have the insurance. Well, maybe either the coverage isn't that great, or the network isn't that great, or the company isn't that great. So just be careful there. Use caution. But that's it. So if you're interested in booking with one of our Medicare people, I'm going to go ahead and link it in the description. If you're not, and you're good to go, and you have someone that you're working with, or which way you want to go, and you don't, at least hopefully this video was helpful. And then, yeah, just best of luck. And if you have any questions, let us know. Thank you.